Good afternoon. My name is Rhonda Butler, and I would like to present to you my strategic communications plan to achieve a total integrated networking system that will include both vertical and horizontal users. We deeply took into consideration our mission and our core values in developing a communication strategy. This communication strategy is designed to help our organization communicate effectively and meet core organizational objectives. They are addressing the needs of the blind and visually impaired, including those with multiple disabilities, chronic medical conditions, education of healthcare services, and community outreach. We all need to be connected. When the mission goals and objectives are understood, the people and its resources become the agencies. The communication strategy shows how effective communications can, 1, help us achieve our overall organizational objectives, 2, engage effectively with stakeholders, 3, demonstrate the success of our work, 4, ensure people understand what we do, 5, change behavior and perceptions when necessary, and 6, it measures qualitative data being recorded, monitored, and evaluated of who, what, and when information is being used. Why we need this change? The need for this new system is that our current method of email being used to relay information to our 8 departments is narrow and causes delays in our customer service. It restrains the need to know by not including every member using our email approach. Email is an extremely popular form of communication in business, but it can often lead to major problems if the underlying tone of the email message is misinterpreted at one end. If the parties involved are in different emotional states of mind, the slightest disagreement via email can quickly spiral out of control, leading to a full-blown argument. Another reason for change is government. Our growing customer base and fast changes in the insurance benefits due to the managed care system is calling for faster responses in care and resource management. Managed care offered freedom of choice and opportunity to pick what services you want. The insurance agencies decide how long and how much time is spent on these services. The need to understand new policy agenda is essential to our core services. We have our networking system, which includes our financial department, HR, our co-workers, a chance for learning and growth using the public, community boards, and TV, alliance of interest groups such as social workers and technology technicians. We have a good customer base. We also have prospective customers through outreach, outside stakeholders, and community in-services. The purpose for communicating this new system is Objective 1, to ensure all staff know and understand the standards of care expected. Objective 2 is to ensure service users have opportunities to communicate their needs within the organization. And 3, to regularly gather feedback to ensure we are maintaining standards of care and support. Everyone communicates. Our strength is our professional staff that is embodied into 8 departments of caring that is given to our consumers. This justifies the opportunity of reaching them with full capabilities and quick resources of the care that we provide. Communications, as you can see, consists of our senior executives, agency directors, employees, information technology, service providers, outreach workers, financial budgets, interest groups, our insurance representatives, prospective consumers, and government agencies. How will this work? Information pop-ups and walkthroughs. This program that integrates our computer system and uses pop-ups instead of email. This is a quick source of sharing information and can be passed throughout the departments for fast use. This system uses pop-up messages of channels. The messaging tool separates messages into channels for alerts, surveys, quizzes, meeting invites, summary of meetings and reports, our newsletter, and human resource policy. Our IT department is capable of creating this program. If you have any questions regarding these channels, how to input, please feel free to contact myself or IT. Examples. Surveys can pertain to customer services, community outreach, or employee satisfaction. Quizzes can be used to follow up on understanding important facts given at a meeting. Insurance policy changes can be relayed to everyone at the same time, and action can be taken by those involved. Resource availability can be posted, and outreach can be updated immediately of any service changes. The urgency of this strategic communications plan will immediately dismiss misunderstanding and ensure that everyone's actions are on one accord. With this all-inclusive desktop program, it will keep employees informed without interrupting their daily routine. To further communications, managers and supervisors will do a walkthrough to address any employees' inputs of this system or possible changes. They also will be accountable to relay information to the 3 employees that do not have access to a computer. I would like to thank you for your time and consideration of this proposal. Remember, if you have any questions, feel free to contact myself or IT department.